Okay, so here we have Nancy, and just about 3 months ago, we decided to do some laser guided stem cell signaling therapy. We treated both knees and the neck, correct?
It was my right knee
Yeah,
and my lower back.
there you go. So, how's the knee holding up 3 months later?
Oh, amazing.
Okay,
Big, big difference.
all right.
I can
What was it
sit
like before we
up.
started the treatment? What is it like now?
Before treatment, I was uncomfortable regularly. I like to do yoga. I couldn't do a lot of my yoga poses. Now I'm back to normal pain-free yoga.
So, which yoga pose bothered you the most before?
Uh, the one where I sit on my knees, I forget, it's hero's pose,
Okay,
which,
all right.
yeah, yeah, yeah.
Oh, you sit on
And,
your knees and you go back, right?
well, or you just sitting with the pressure on your knees and your heels touch your rear
Yeah.
end.
Uh-huh.
And I couldn't do that. I had to have a pillow underneath me to cushion. And
Uh-huh.
now completely, I can, like my heels can touch my rear end and I'm pain free. Yeah, it's great.
That's incredible. Hey, Melissa,
Yeah.
I'm gonna have you film after we're done. Let's try to do it right now. I'm gonna make that table behind you flat so we could demonstrate what was that
Sure.
hero's pose, what was a sticking point before, and what is
Right.
it like now, just to demonstrate that this stuff really works. You're not just saying it. So
Oh yeah. Yeah.
yeah. So Melissa, why don't you pull up the bottom, make it flat? Yeah.
I'll take my shoe off.
All the way up. You got to pull the lever on the right side. All right. So I want you to demonstrate, and you're going to get on the table, so you'll be facing the camera. So
Okay.
get the armrest up so she can squeeze in. Yeah. All right.
So
So
before,
demonstrate what was it like before. What was the sticking point before?
like before when you're like this, it was like, ooh, I could barely, like on my right side, I could do it, but my left side, I could have it back here, like, see, I can touch. And on
Yeah.
the other side, I couldn't. And
Okay.
now I can do it and
All the way back. Yeah.
and I
So
can even
what?
do like camel, well, it just certain ones that
Yeah.
really put pressure on my knee. And
Yeah.
just sitting cross-legged like this really was a challenge. I
All right.
just was uncomfortable.
Could
So
you mimic what was it like before in the bad knee, the
um,
Indian pose?
well, I could just the Indian pose. That's
Yeah.
funny. I could do it, but after time, if I was sitting in that pose for a period, it was very uncomfortable, and I just couldn't. You know, you don't want it to be painful. So then
Yeah.
I sit like
And
instead.
what is it like now?
It's fine.
Yeah.
It's fine. I
All
can,
right.
I can do pretty much what my body will let me do.
Yeah.
Sometimes I'm not that flexible, but
Yeah. So how many percent better is your knee 3 months after?
I'd say it's 85% better.
That's incredible. Just 3 months.
Yeah.
Remember I
And
tell
once
you it takes a year, about 10% improvement a month. You're already like making 8, 9 months progress in 3 months. So triple the speed. And how's your low back doing?
it's doing much better. I still have just a little discomfort now and then, but it's minimal,
All right.
and it just depends on what I do.
Exactly.
But it used to be hard to get out of the car. And now I can just get out of the car like normal, not even think about it.
Yeah, you don't
Or
have to like lift your leg and go like that.
right.
and
I used
fall
to
out.
have to lift both my legs and turn and then hold on and pull myself up.
Well, you're making
So,
fantastic progress. So what we're going to do, we're just going to give you a maintenance treatment on your back and knee today with the shockwave
right.
laser and decompression. And we'll have you
Uh-huh.
come back for your 6 months follow-up, which will be in 3 months to make sure you're making long-term progress. All right,
Great.
congratulations.
Thank you.
You,
It's just wonderful. I'm so glad I did this and that, you know, I connected with you and
well,
your staff is wonderful, everything. So,
yeah, well,
yeah.
without them, we couldn't do it. So yeah. All right. Well, thanks for doing your actual homework. You know, the home laser and all that makes a difference to activate
Oh
the
yeah.
cells. Yeah.
I religiously did that, and in the beginning, 3 times a day. That
Yeah.
was, and on two sites, that's 3 hours. Which,
Yeah. Yeah.
I said I'm gonna, commit to do this, and luckily I'm retired, so I could do that.
There you
And
go.
it's been fantastic. And then we bumped it down to twice a day. Now, how often do you want me to do
Once a
the?
day's fine. Yeah.
Okay.
Just half hour on the knee and half hour on the back. You should be fine. All right. Who knows?
Really?
Maybe next time I'll tell you. Well, you could do it 3 times a week. We'll see. All right.
Yeah, yeah. But hey, I'm gonna do it because I can. It almost it feels good because you feel the heat in it,
Oh
and
yeah, it warms the tissue. It
right,
creates blood flow.
right.
The
Yeah,
light activates the cells, just like you need vitamin D for strong bones. Well, this light activates the stem cells so they continue to proliferate. All right.
right, right on.
All right.
Good.
Congratulations. So Melissa's going to get you treated, and we'll see you in a few months. Okay.
Okay.
All
Thank
right.
you.
Mhm.